What's going on, everyone? Happy Thursday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, March 14th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be harmful to you. We do stuff such as state updates, wastewater, which is really important for checking out the levels in the viruses, and we do talk about the latest news. So if you like what you see here, give it a thumbs up. If you want to follow along to the daily pandemic update, subscribe down below. It's really the best way to help keep you safe and informed. And if you know anyone else that needs to know this, let's face it, anyone who's at risk of being infected, which is everyone, needs to be informed. So share this with anyone you know. It's not a terribly busy news day today. However, there are a couple things that we're going to talk about, and I did have a few things pre-planned that I wanted to discuss today. So we're looking at about the 10 to 15 minute range for today's update versus some of our longer updates. First thing we'll talk about is the news, and then we'll take a look at air quality values, and we do want to take a look at what is going on with wastewater in the south. Remember, it is spring break season, so we want to check up on areas that I know of that are currently dealing with surges of people for spring break. And at the end of today's pandemic update, we're going to have an announcement about something that I'm going to be doing tomorrow evening. I think you may guess what that is. And of course, we do have some weekly state updates today. All right, just two news items for today. No news day or slower news days are good things, but I don't think it means that things aren't happening. Things are happening, we're just not hearing about them. But hey, it is what it is. COVID-19 leaves its mark on the brain. Significant drops in IQ scores are noted. And yes, brain fog is a problem that is ongoing with people who catch COVID. And let's face it, have you noticed people, you know, say you're going to a customer service for help, or you're talking to someone on the phone, and they just have a pause. They're like, "Oh, what did you just say, my friend? I'm sorry. I was in a daze. I'm sorry." I'm noticing it happen a lot. Would it happen before COVID? Yeah, here or there, but man, not as much as it is happening now, folks. It is happening quite often, and it is very noticeable. Let me know if you have seen people just suddenly freeze, pause, go into a daze when you're talking to them. Let me know in the comment section down below. I'm really curious. Then we go over to my website now. Republic of Congo is reporting that they have 43 Mpox cases. This was posted on my website by my moderator, Steve. Always posts fantastic stuff. Thank you for everything he posts. Summary: in the country of Republic of Congo, an internal health ministry report stated there are 43 cases of Mpox in the country. The cases are distributed throughout 9 of the 12 departments, which may be viewed as state or provinces. Yes, this is really interesting. So we've been talking about Mpox a little bit more frequently within the past few weeks. So clearly there is somewhat of a higher prevalence of it around the world, and I don't think we're done hearing about it just yet. All right, skipping over this next tab, we'll get back to that at the end of today's pandemic update. And you do see here on this day in pandemic history, I searched a page for that. CDC has a timeline archive, and I typed in today's date, and this comes up. Back on this day, on March 14th in 2020, CDC issues a no-sail order for all cruise ships, calling for them to cease activity in the waters that the U.S. holds jurisdiction over. And yeah, that's because COVID was going bonkers. And now I hear so many people. I do these searches on Twitter sometimes just to see, I wonder if people are getting sick on cruise ships. Let's do a little search. Are people tweeting about illness going around on their ship that they're on? Sure enough, it pops up. It's like no one cares anymore. And I got news for you. Some of these ships, some of the smaller ships, I might have told you this before. As much as I try and tell my parents to stay safe, not to do risky things, they went on a cruise back last year in September. That's how my dad got COVID. The ship that they were on, it was Viking Cruise. I'm not ashamed to admit it. I'm just going to flat out say it. It was Viking Cruise. I don't know if it's because of legal reasons. Someone told me it's because of legal reasons, but the point I'm trying to make here is Those smaller ships, I think their ship had 150 people at the most, something like that. No medical staff. Would you believe it? No medical staff on board the ship. Yeah, it's just totally crazy. So, of course, these ships with outbreaks to this day are going undetected. When back on March 14th of 2020, ooh, no, we better stop all people from sailing because that's a big spread of COVID. It's like we don't even care anymore. Yesterday we talked about the CDC showing up at airports doing swabs. Quite frankly, I think they need to go to some of these ports where there's a high volume of ships that set sail. Why not do some swabbing of the people that are coming off the ships and see what they find? Yeah, they'll find COVID, and trust me, there's other stuff going on these ships. We still hear about norovirus outbreaks. I mean, ships were a petri dish for viruses before COVID. I can't even imagine now, especially what is that new ship Celebrity Cruise Lines has out there? uh, Something of the seas. I forget what it's called. We talked about it recently. Like 6 to 7,000 people on one ship. Yes, again, a petri dish for viruses. All right, moving on here. Just totally ridiculous. Taking a look at this. Here's today's air quality values, and I suspect we're going to find the east is not doing all that well. I'm refreshing this. The east hasn't been doing well because we're dealing with very warm temperatures. I don't know if we hit a record here in Philadelphia, but I got a weather station. We hit 78 degrees on March 14th here in the northeast section of Philadelphia. Unbelievable. And what goes with warmer weather at this time of year? Bad air qualities. And take a look at this. Yellows. Even a couple red sites showing. Look at New York City. Wow, a lot of oranges and even some reds in New York City. Yeah, you might want to be masking if you're going outside for more reasons than just the air quality, meaning toxic air, but allergies. Yeah, they're starting up early, especially if you're in the East Coast where the weather has been warmer than normal. And one of the issues I'm dealing with is my itchy eye issue start. It's not that bad yet, but I am going to be taking my Allegra pretty soon. I got it sitting over here, and I think it's that time of year. I took it last week, and I think I'm going to be starting up with my taking it daily because, I mean, it works for some people. You take what works for you, but Allegra does work for me. That's what my doctor wanted me to take, and it does work. But yeah, allergy season, it's coming. We might have to start adding the allergy maps into our pandemic updates. I think that would be a beneficial idea. Take a look at the southeast. Wow, these orange and reds, just totally out of control. West Coast, not all that bad right now. That's good to report. Seeing some oranges up in Canada. Not sure what that is all about, but hey, it's something we'll have to keep an eye on. And again, yeah, these air qualities are going to be bad for the next several days. All right, moving on now. Let's take a look at Philadelphia EMS calls. 752 reported for Wednesday, which is actually not all that bad. It's not near the 800 number. It's not below 700, but hey, we'll take it. Taking a live look at what is going on in Montgomery County, Pennsylvania. Wow, a lot of fall calls today. What's that all about? 16 active calls right now. Taking a look at Chester County. I have to refresh this. Yeah, I didn't think that was correct, and not all that busy right now. There are some calls, but not too many. Respiratory difficulty, another respiratory difficulty, sick person, heart problem, senior seizures, and we are seeing abdominal pain. I would expect to see more respiratory calls the next few days, just because you saw locally here in my area how the air quality, it's not perfect, so that could be messing with some people's allergies and some people asthma or COPD. All right, let's refresh the wastewater scan. We left you off yesterday in Memphis, Tennessee. We do want to take a look at what is going on in the southeast U.S. Remember, it is spring break season. A big area for spring break is Florida. We're going to make multiple stops here in Florida. Here's Miami. You see Miami flat at this time, not dropping. They were dropping, but now it's flattened out. We'll have to see if we see a small rise here. This is for COVID. RSV continues to drop. Influenza A, not much of an issue. Influenza B has taken somewhat of a rise. Norovirus is rising at this time, and you would think it would continue rising with spring break. And taking a look down here, hepatitis A, there are some detections of that. No detections of Mpox at this time. Let's go a little bit further to the north. Let's see what is going on in Jupiter, Florida. Jupiter, Florida today is reporting, ooh, this is not good. COVID is starting to rise ever so slightly. We'll have to see if that becomes an issue going forward. RSV is low at this time. Influenza A, slightly rising. Influenza B was slightly rising. Now it's dropping ever so slightly. And we can see norovirus. It looks like it might be starting to rise again. Mpox, no issues. And hepatitis A, there are some detections of that. Let's go take a look at Disney World or area or Orlando in general. We'll go to the south side of Orange County. We'll see what's going on here. We note that in South Orange County, COVID is low. It's dropping. This is good. RSV is low. Influenza A, not much of an issue. Influenza B, not much of an issue. I mean, it's staying high, but again, look at this. The levels, they have really dropped. It's almost down to, it's below 20 pathogens detected, so that's not all that high. Norovirus is medium and dropping. This is really good. Mpox, not much of an issue. And hepatitis A is not much of an issue now as well. And I know, we're showing a lot of Florida. Going to do one more spot in Florida. Northwest Orange County. COVID, it's medium. It's rising ever so slightly. RSV is low. Influenza A is rising slightly. Influenza B is dropping. Norovirus is rising ever so slightly. It still is high at this time. Mpox, no issues detected. And no detections of hepatitis A recently. Let's take a look here. And no, the most recent one goes back to February 22nd. None for March so far would be the proper way of saying that. And that concludes our tour of Florida. What do you say we just go somewhere else random and quickly take a look at what is going on? How about we go out to the West Coast? Yes, some people do go to the West Coast as well. Is it a thing to go to Los Angeles for spring break? I've heard of people going to Los Angeles. Let's go up closer to where Hollywood is. This is the northern wastewater site in LA. Low for COVID. RSV is coming up medium, although again, not many pathogens detected. Don't know why it says that. And we can see here, there were no rise in influenza A, slight rise in influenza B. And when we come down here to Mpox, no detections. The most recent detection of hepatitis A was on February 22nd. And norovirus is just rising ever so slightly. It's more so flat at this time. All right, taking a look at the latest variant proportion, which will update tomorrow. JN.1 is at 92.3%. Taking a look at New Jersey for today, 366 hospitalizations with 67 out of 70 hospitals reporting 22 people on a ventilator, 55 people in the ICU, discharges, another 77. New York State hospitalizations today, or New York State cases first, 930. That's up ever so slightly. Now New York State hospitalizations, and we see that there were 743 people hospitalized, 92 people in the ICU at this time. All right, for the continuation of the pandemic update, we have to go over to another browser. That's right, we have to come over to Google Chrome now because I got a whole slew of states that we're going to quickly run through. First off, the Connecticut Department of Health is reporting for the current week, and mind you, this is incomplete data, so far this week, 473 influenza cases, 257 COVID cases, 34 RSV cases. That number will likely go up. And the total for the previous week was 1,335 influenza cases. Previous week for COVID was 780. Previous week for RSV was 98. Pretty big drop in RSV at this time, and hopefully these drops in the other viruses continue. All right, let's take a look now at California, which will not update till tomorrow, but I don't recall us talking about last week. Last week, the positivity rate for COVID dropped ever so slightly. Influenza was up ever so slightly for the positivity rate. And LA, drumroll please, let's see if LA has updated. Yet I have to refresh this, and it does say this data, let's see here, of the 7th, so it's still from last week, where everything at that time was dropping. Taking a look at Colorado. Good news. The hospitalizations, they were at 128. They took a big drop this week, down to 96. And cases this week also dropped by 103 to 1,220. Chicago, more good news. Average hospitalizations are at 14. That's down. Hospital bed use is down 1.6%. Emergency department visits says down 1.1%. Laboratory confirmed cases is down to 83 versus 107 the prior week. Deaths, they're up ever so slightly, but remember, there was that ever so slight increase in average hospitalization. That probably explains it. Vaccinations in the past week. Booster shots, first time people getting vaccine, yeah, that still is a thing. 3,155 people vaccinated. Take a look at Massachusetts. And I don't think this is this week, so it's still last week, but we'll report on it anyhow. We'll revisit this page tomorrow. 13.6% of all emergency department visits were for a respiratory virus. Influenza level is moderate at this time. Taking a look now at what is going on in Washington State and emergency department visits for the viruses. COVID, down 20%. Influenza, down 9%. RSV, down 33%. Hospital admissions, COVID, down 32%. Influenza, down 13%. RSV, down 25%. ICU beds occupied, down by 5. Influenza, down by 2. Their total number of ICUs for COVID is 20, and influenza is 12 at this time. And I think we do have some data out of Kentucky. Yep, we do. For COVID, things have dropped at this time, and look at this. Everything for hospital admissions and emergency department cases, or visits, have dropped at this time. So that is good to see. All right, we have to go back to the other browser. Drum roll, please, the big announcement that I say for the end. That's right. Tomorrow at 8 p.m., I will be doing a space. Tomorrow is Long COVID Awareness Day, so I felt, you know what? Let's do a space where we talk about long COVID. People can share their stories. I'll share my story. Some of you may know the story. Maybe if you're new, maybe you don't know the story. Maybe you're new to follow me on Twitter and you don't know my past. I'll share my story. Then you can share your story. We can collaborate with things we're doing to help with long COVID and, go from there. It'll be a learning experience. It'll be a good place for people to, share support for each other. And I think it will go well. The goal is to end at around 10 p.m. Look, I've done spaces many times before. It will not end at 10 p.m. It will likely go much later than that. So, we'll see. Anyone who wants to speak and chime in will be allowed to. Probably by 8:30, we'll start bringing people up to the microphone. And people can talk and chime in. So that's tomorrow, 8 p.m. I'll be doing a space. And another note, tomorrow's pandemic update will likely be an out in the wild update. So I'll give you that tomorrow. And Saturday is when we'll probably get into the new variant data and all the new weekly data from the CDC. Unless I do find time to do a data-filled update. Alrighty, folks, that does for today's pandemic update. Look at that. We went longer than expected. I will see you all again tomorrow. If you like this video, give it a thumbs up. Want to see more content like this? Subscribe to my channel down below. If you know anyone that needs to see this content, which is anyone who could become infected, by all means share this with anyone you know. I'll see you all again next time. Until I see everyone again next time, have a fantastic Thursday evening and stay safe, everyone. Thanks for watching.